Hey folks, welcome to my channel, or welcome back to my channel, whatever the case may be. This is the kitting up of this beautiful amber owl from Felica Art. Isn't it so pretty? Yeah. So, yes, everything is still skewed. Still gotta work on getting things set up. But I have started just a little bit. I've already done in my notebook in here. I've got quite a few now that I need to work on. As you can see, I've got 1, 2, 3, 4. That's a double pager. 5, 6. That's a double pager. 7, 8, 9. And now this is number 10 in here. That oh my goodness, I still have to work on. But anyways, so I've got my amber owl all written out in my notebook. Yay! And I figured I'd work with these because some of the colors, there's lots. Other colors, not so much. Yeah. So, and a lot of the symbols are the same. A lot of the symbols are the same. So, anyways, so let's get started with cutting these, and I'm setting them in this tray so that I can work from the tray. So let's set this aside so I can cut these easier and make sure that I just grabbed one, and this is so let's see, number 16 and number 17. So there are a few green colors, some tan colors. Oh, there's two of the same. This one is, there's two of this one. So I'll keep them together. Two of this color, 739. One of 741. So I'll just set them like that in there. Yada yada, la la la. So yeah, okay, next. Oh, this is number 4. And 5. And 6. And okay, so there's 2 of color number 7. And then we've got number 8, number 9, a bunch of these greens, yep. Number 10, 11, and 12. All right, next. Okay, 21, 22, 23. There's 25. Yeah, so some of them, there's very few. And then some of them there is a lot. Yeah. Jeez, oh, sorry. That was, I have the window open and the breeze, it's windy out. It's pretty windy out, and it just blew my door closed, which is fine. Okay. So now here we are, 31, 32, 33, 34, 35, 36, 37, 38 and 39. All right, so it looks like I need another one of these trays. Oops. Okay, so I'm actually going to take these doubles and move them, because the doubles do take up a fair bit of space. The really big ones do too. But there. Let's do this now. I move my stuff around all the time. I'm always rearranging things, and yeah. All right. So now here is number 1. And here is number 3. And now number 2, I'm just going to cut this because it's a lot. Yada yada. Okay, there we go. Bunch of 3s. And some more 3s. And there we go. Okay, now. Alright, there, just make some room. And, oops, bring over my tray. And where should we start? Well, let's start with number 3, which is number 3. Now, let's see here. That looks like it could fill a small one. So we'll go with this one. And I'm just taking the sticker and covering it up, just like that. And then I like to, I'm a bit on the particular side for how I'm a little weird for how I like to open my baggies, right? I like to have the label on the other side so I can actually see all the drills. And then I cut it on the side, I cut the corner off on the side that where it's like folded and not sealed, right? That way I can see everything in the bag in the packet. So that I know, and I did it wrong because I like to do it this way, right? Whatever. Sometimes it's one way, sometimes it's the other way. I don't know. It's been a while. It has. It's been a while since I've done since I've kitted up a canvas. I think the last one I kitted up was my Dreaming in Color, and then I started working on it. Anyways, there is the first one. Yay, there's the first one. So we'll put that one up there. Now the next one is number 1, and that one I've already got stickered, because I was gonna just sticker them all, and then it's like, wait a minute, it might not, it's probably not gonna work that way, so yeah. All right. So yeah, see, okay, I'm just gonna pour them. What I'm gonna do is I'm gonna pour them into here. Because see, this is how I like to do it. I like to pour it in this way, right? But because of the way these containers open, I can't do it that way. So I'll just do it this way. And there is number 1. Now, number 2 is all of these black ones, and I will leave those for later. I'll leave those for later. So next, yeah, so we're just going to do these ones in order in here. All right, so this is 35. So we look on here, 35 is a capital H, and it's a teeny one. So, yeah, good. We've got a little one for the H, which is good. Good, good, good. Not that it would make much of a difference. It's just, I'm weird. What can I say? I'm weird. I do things in a weird way. I do things, I change the way I do things until I find a way that works, for me, that I find to be the most comfortable for me. Right? It's just the way I am. I know I'm a weirdo. Alright, so we'll put that there. And then next one is 33, which is this one right here, which is just the line. The minus symbol. Yeah. There. Open it up. Yeah, I'm just going to make a mess with the baggies right there for now. I'll clean them up later. All right. There we go. Another one. Done. Okay, now this one, 32, is a larger one, and it is a plus symbol. So let's see, is there a plus symbol on these? Nope. Now, I want to make sure that this is actually going to fit into that. So before I even put the sticker on it, I'm going to open this up. Pour them out. And then fill this up. And look at that, just perfect. Hopefully you can see everything that I'm doing. All right, so that was 32. Yes. Me and my squirrel brain. I actually remembered. Okay, so there is the first one of those, that size. Next is 34, and that is a square, little square. You know what? Forget it. I'm just going to go little square. This X is now a little square. And open it up. And dump this out. All right, and then we'll just keep doing it this way. Now that I'm got a bit of a rhythm going, I'm gonna tell you about why it's been a while since the last time I did a video. So this is 38. I am going to, this is, E. Let's see. E. Okay, so, I've been having issues again, and with my health. Now what happened was at the end of June, like I've been working on trying to lose weight, trying to exercise and whatnot, and I bought a treadmill, and I've been trying to use it as often as I can. Now I saw a piece of trash. There we go. Put that in there. Okay. So yeah, I've been trying to eat better, lose weight, exercise, all of that stuff, right? So I can start like doing better in life, right? All right. Now, here is 39. Yeah, this is going to be another one of these. That's this one. So anyways, at the end of June, I went 2 days. I ended up with really bad stomach pains for a couple of days. And so it was a Sunday and a Monday. I had really bad stomach pains. And then on Tuesday, I'm like, well, this is getting ridiculous. I'm having trouble sleeping because of the pain in my stomach. It's hard to breathe. I can't do anything because it hurts. My stomach it's too much. So I called 811, which here in Canada is the nurse's hotline. And I explained the situation to the nurse, told her what was going on and whatnot, and she's like, yeah, I think you need to see a doctor right away. Okay, so now this is just too full. And so what I'm going to do instead, unfortunately, I already put the darn sticker on. That's okay. But I should have waited to put the sticker on. But I don't always think things through when I'm... Anyways, let's see what we can do with this sticker. I know some of the round sticker underneath is going to come with it. Anyways, so I'm like, okay, I hopped in my van and I went to the hospital, parked in the visitor parking area. It's a 2-hour parking only, basically. It's for patients as well. It's for patients and visitors, but it's like maximum 2 hours type deal, right? And so I'm like a little concerned about being parked there for overly long. Thankfully, we don't have like paid parking for our hospital, unlike some hospitals, some cities do. But anyways, so there's that one. I go in to emerge. I do the triage thing. Okay, 37. 37 is G. I do the triage thing, and then I'm sitting there waiting. And waiting and waiting. And then they take me into a room and do my blood pressure, and they did some blood. They did blood pressure. They got my vitals, and they got some blood work. Then I had to go back and wait out in the waiting area, and until they called me again, and then they took me into the actual emerge, and they have one section of emerge where it's just chairs, where you can just sit for those that are able to sit and whatnot. So I'm sitting there waiting, and then they come and they get me, and they come. Oh, what was it next? No, they asked me some questions, and it's like, okay, no, I have. They're concerned about possibly constipation or an obstruction, right? So they're like, okay, we're gonna get a CT scan done. Okay, I've never had a CT scan done, so they wheel me to the CT to the lab there to get the CT scan. They take me into the room, and I'm like all excited. Oh, yay, cool! And they're like looking at me weird. And I'm like, they're like, we've never had that reaction before. I'm like, it's a new machine. I've never had one of these before. Yeah, I know. They're like probably like looking at me really weird, and it is what it is. So I'm pretty sure this is gonna be too much for one of the smaller ones. So I'm just gonna put the sticker on and go with it. 22. So then, oh, before that, before that, they got more blood work. They gave me something for the pain. They gave me this nasty drink called a Pink Lady. And I know it's a combination of medications, right? So they give me that before taking me down. They also gave me a Benadryl. Because I don't think I had... No. They didn't give me a Benadryl. No, that was later. I got the CT scan done. Yes, I got the CT... They did the CT scan. They injected me with the contrast, which is like the radioactive whatever, so that they can see whatever in the CT scan. So got that done. That was interesting. With my issue with needles, the way my skin is with needles and whatnot, yeah, it was not overly pleasant. So then they wheeled me back to my chair, because they had me in, they had me in a chair. And so I'm sitting there waiting, and then all of a sudden, one of my lips, I can feel it starting to swell. My upper lips is starting to swell. It's like, wait, this shouldn't be happening. I take allergy pills every day because of my allergies. Why is my lip starting to swell? I haven't had my lips swell from an allergic reaction to anything since high school. So yeah, it's odd. So then I ask the nurse if I can get an allergy pill because my lip is swelling. And she's like, oh, okay, well, is there anything new, different, whatever that could have caused it? And I'm like, well, the only thing new and different is the CT scan, because I've never had one done before. She's like, oh, okay, so it sounds like you're allergic to... Okay, you're allergic to the contrast. Oh, okay, yeah. So they give me a Benadryl, and then they give me a bracelet that says that for allergies, that I'm allergic to contrast. Yay! How fun, right? By that time, both lips are swollen. Just, yeah, you can tell both my lips are swollen. Joy. All right, 23. There's a fair bit with this one, so, but it's gonna, I say I'm gonna check just to be on the safe side. I'm gonna see 23. Just check and see how full it'll fill it. Oh yeah, it's full, but it's, yeah, all right. Okay, so anyways, so they eventually come back and they're like, well, apparently, according to the CT scan, you have blood clots on your lungs, or in your lungs. Yeah, blood clots in your lungs. Great, wonderful, absolutely fabulous, right? Well, this really sucks. Okay, we need to do another CT scan. We're gonna do some more blood work, and yada yada. We want to, oh, plus they're like, according to the blood work, you have a high white cell count. Well, I already knew that because of getting blood work done a couple of weeks prior to that, and the doctor wanting me to go and get more blood work done because of high white cell count. But now it turns out not only do I have a high white cell count, but I also have what's called blast cells. And those are apparently like immature cells or something like that. I can't remember. Off the top of my head, I can't remember. Anyways, I'm going to set this, yeah, I'll leave that one there. So 29, those are, let's see, just in case, yeah, no. So then, they're like, yeah, so have to get another CT scan done. I was like, okay, wonderful. And another, more blood work done. And try and figure out, like, see if there's the possibility. They wanted to rule out leukemia with this blood work and the tests and whatnot. They want to rule out leukemia. Because depending on the test results would determine on whether I would have to go to Vancouver to the major hospital there and see a specialist, or like a special oncologist, or or if I would have to stay here and get a bone marrow biopsy done. And well, it's like, well, I really don't want to have to go to Vancouver to see a specialist, because how would I get there? How would I get back? Where would I stay? All of that stuff, right? And I really don't want to get a bone marrow biopsy because those things are, well, they're pretty intrusive, because they're digging into, like, they're literally taking, like, it's like a drill sample of your bone, because they got to drill into your bone to get at the marrow inside, because they need a sample of that. So anyways, it's like, oh, this really sucks. Okay. Either way is gonna suck. So by the time we went, by the time I was, they took me for my second CT scan. The swelling was pretty much gone from my lips, which was great. I'm glad about that. But because of my allergy to the contrast, they gave me some extra medications, extra stuff to prevent me having another allergic reaction. And it worked. It worked great. Unfortunately, they had to shoot the contrast into me really, really fast. They had to push it really fast, which meant it hurt like an SOB. Oh my goodness, did it hurt. Yeah. I could barely hold still when they did it. But it's like they injected it, it hit me, I'm like, oh my God, freaking out, and it's done. Thankfully, it was just that brief. So, after the second CT scan, they're like, okay, well, now we're going to have to keep you here. You're going to be here at least for overnight, until we know whether you're going to get the bone marrow biopsy or go to Vancouver. And it's like, oh, great. So, oh yeah, after my second CT scan, they wheeled, or before. Anyways, at some point that afternoon, they actually put me into, like, they relocated me in Emerge to a bed. So, yeah. They got me a bed. And then I was there for a while, for a few hours, and then they excuse me, and then they took me to and then the nurse came eventually and took me to my room, my own room. But it wasn't actually a room either. It was a bed in the hallway, a little alcove in the hallway. And I had privacy because there was a privacy curtain. So it was pretty private. And in the meantime, I'm like messaging my daughter, messaging my dad, I even messaged my sister and was telling them everything that was going on. And I wasn't messaging my boyfriend because he was sleeping. Because he had to work that night. Yeah. And I asked my daughter, I asked Wolfie if she could put a bunch of things into a bag for me. Like some clothes, a change of clothes, my Kindle, charge cord, and a few other things. She threw in my back scratcher, and fan, and she threw in my fan, one of my little fans, which was awesome. I was so grateful for that because I actually really needed it. I didn't even think of it, but she did. Okay, so this is number 4. I forgot to do the sticker. All right, so we're just gonna do the number 4 on this one. Yeah. Okay, so then they get me to my own little alcove there, and unfortunately, it's like right by the elevators. Like you open up the curtain at one end, and the elevators are like, you can see the elevators. It's like, whatever. Not that big a deal. 9. 9 is 9. So she packed my headset as well as my Kindle, so I was able to, I tapped into the Wi-Fi there. Oh yeah, that's another thing. Before that even happened, our Wi-Fi went down, so then we ended up looking into changing our Wi-Fi, getting our own Wi-Fi. So yeah. During the week, I ended up staying 4 days in the hospital, and during that time, we were still waiting for a modem to arrive in the mail, because the modem was actually supposed to arrive the Friday before I went into the hospital. But yeah, it arrived Monday or Tuesday the week after I got out of the hospital. Monday, yeah. And then had a heck of a time trying to get it set up. Because plugging it into because we had to plug a coaxial cable from the wall into the modem. And, well, there was 2 outlets, coaxial outlets in the one corner in the living room, and tried them both, and no signal, nothing. And I'm like, well, I need a technician to come and help figure this out, because outside it looked like the cords, they were there. The other end was just not attached, not hooked up to anything. So we finally got a technician to come over and fix the problem. So the modem is actually now in my office, because he said it was just easiest to do it there, because there was just too many wires, cords, and stuff outside. So anyways, as I was saying, yeah, squirrel brain, right. Hospital. In my own little alcove, yeah. I was hoping that my boyfriend would be willing to drop off a bag of stuff for me. that night. But he said that he would drop on his way home after he'd bring it after work. And I was asleep when he dropped it off in the morning. But thankfully a nurse there had was able to lend me a charge cord, which actually it was a double port charge cord. So I was able to charge 2 devices at the same time, but there was only the one cord, which was fine. Because my daughter Wolfie packed my charge cord and a charge cord and a charge base. But I ended up using the charge base that was lent to me. Because then I could be charging. I could be using my fan and watching. I could be using and charging my fan while using and charging my Kindle or one of my phones. And yeah, the only thing I was not able to charge while I was in the hospital was my watch. So the first day there, I took it off, put it in my purse, and then just left it until after I got home. So anyways, so that was the Tuesday that I first got there. Wednesday was the 1st of July, holiday, no doctors. I was informed that before the end of the day, on the Tuesday, the doctor said that I was going to have to get a bone marrow biopsy done. But and they wanted to keep me in the hospital until after all of the test results came back. Okay, fine, not a problem. But I had to wait until Thursday to get any tests done, because Wednesday was a holiday. It's like, okay, not a problem. So Wednesday I was there chilling and all that stuff, and I did have my daughter packed a diamond painting for me. I had a cloth book bag that I'd gotten from the dollar store that I was gonna work on my friend Joan's live stream, but then our internet went down, and yeah. So anyways, I managed to catch her live stream on that Wednesday, and ended up working on the bag during her while watching her live stream. They did end up getting blood work, I think once, possibly twice that day. Yeah, once or twice. I can't remember. Yeah. So that day was actually quite a nice quiet day. Then Thursday morning, I'm being told, okay, on Wednesday I was told that they had a doctor that was going to do the biopsy. And I was also, there was going to be a, what's it called? A Doppler on my legs to look for blood clots because of the blood clots in my lungs. The Doppler, it's a fancy type of ultrasound. So, and they were going to do both of those. They were going to do the Doppler in the morning and the biopsy in the afternoon on Thursday. Then it's like, oh no! Instead, then it's like, talking with the doctors. We're talking with other doctors, and it's like, okay, no, we're going to do the biopsy Thursday. We're going to do the Doppler and an echo on my heart the next day, on Friday. Okay, fine, not a problem. Then I get up the next morning, Thursday morning. First thing that happens, like The nurse comes and says, okay, they're gonna do the biopsy around 11:30, and they're just gonna do the Doppler and the echo the next day. Okay, not a problem. All of a sudden, doctor shows up, and he's like, yeah, I'm here to do the biopsy. It's like, wait, what? Yeah, we figured we'd just get it done right away, first thing in the morning. And then, so they start getting ready to do the biopsy. It's like, oh my Lord. Because they needed extra space, they got some portable privacy walls to set up. Like the privacy divider walls or whatever. And then a nurse also shows up with a cart to do more blood work. And she goes and she pours a bag. I don't know how big the bag was, but it was bigger than this, that's for sure. It was bigger than this. Full of vials of different sizes for blood work. I'm looking at them and I swear it's got to be like it looked like to be about a dozen vials of blood. It's like, oh my goodness. So she starts filling these vials, and the doctor's talking with me about the biopsy, and then he's working on getting things ready and to do the biopsy. And all of a sudden I'm like, okay, I'm starting to feel like I'm getting dizzy, I'm getting lightheaded, I'm gonna pass out. I'm getting ready to pass out, and as I'm like, because I have a history of fainting spells, and I kept talking to them and saying, yeah, I'm gonna pass out, I'm getting there, it's coming, yeah. And then I'm in La La Land, and then I wake up with this doctor over in my face, and he's like, come on, we gotta move you because you're like half on, half off the bed. Yeah, apparently I fell back on the bed. My legs were hanging off the bed. I'm on the bed, laying on my back, and with this doctor leaning over me, and and I'm like thinking, I just want to go back to sleep. But yeah, apparently by that time they had finished taking my blood. Thank goodness. Okay, so this one is going to have to be a larger container because I'm almost all out of the littler containers. I've got 4 left. Oh, look at that. And I've got 4 left. Good. Awesome. All right. So anyways, so then I had to lay on my stomach, and then he numbed the area, did the biopsy. Yeah, it still hurt. It still hurt. Yeah. Oh, plus because of the blood clots on my lungs, I had to. Start on Tuesday. They started giving me injections, blood thinner injections. They gave me one that night, and then no, I think there was just one that day, and then every few hours, Wednesday, and then on Thursday, and then on Friday, these darn injections. But the very first blood thinner injection that they gave me, oh boy, I tell you what, I bruised. I had a massive bruise on my stomach, and right where they injected it, I still to this day have a lump there. There's a lump there. And then the second injection that they gave me, the same thing. Exact same thing. It didn't bruise as badly, the lump is not as big, but is still quite, yeah, quite easy for me to find, that's for darn sure. So, yeah, because they were giving the blood thinner injections, they were just poking my belly in different spots. It's like, show me your belly. I start to uncover my belly, poke. Oh, man. And then, of course, it would hurt for a while afterwards. Because injections, they hurt longer than when they take my blood. Yeah. And it sucks. It does. It sucks. And every single time they go to give me a needle, I have to tell them I have super sensitive skin. I have issues with needles. It always hurts. Oh, jeez. Always hurts. And then it's like, don't. so basically, ignore any noises that I make. Is what it pretty much comes down to. Ignore whatever noises I make. So I'm pretty sure all of these, this is gonna probably fill all 3 of these. Probably, no guarantees. Okay, 19. I'm really hoping that these just take 1 container. Really hoping. So, let's see. So anyways, yeah, so they did the biopsy, all that stuff, and they sent me home on Friday, and they're like, yeah, we're gonna send in a referral for you to see an oncologist. Oh, okay. Because apparently it looks like my blood, it clots really fast. Weird. Okay, that means I cut myself or whatever. Yeah. I stop bleeding faster than the average person. Okay, weird. Because it doesn't seem like it to me, but that's me. That's just me. I take a long time to heal. I know that. It takes me a long time to heal from stuff. But, so anyways, I started on the blood thinner pills and came home and recovering and difficulty breathing. I gotta walk slower, take my time with everything I do. I'm still waiting for that appointment with the oncologist. Finally waiting and whatnot, and it's like, okay, I am missing a color. Aha, that's what I'm missing right here. Haha. All right, so 18. I'm like, wait a minute. I got 3 stickers on here still, and only 2 colors left. What the heck's going on? And it turns out, nope, number 31 is this one. And it was I accidentally mixed. Yeah. Wasn't paying all that much attention, obviously. So, anyways, I'm like, well, it doesn't feel like the blood thinners are working, because they keep saying, oh, with being on blood thinners, and I know this, being on blood thinners means like blood clots are going to break up and they're going to get like flushed away and what have you. So I should be able to start breathing better once the blood clots are gone from my lungs. because it should be like flushing the blood clots from my lungs. That's what the blood thinners should be doing. Well, it's been a month now. And I'm like, well, it should be working, but it doesn't feel to me like it's working. So I made an appointment to talk to the doctor and see about maybe upping my blood thinners. And I also needed a refill on one of my medications. And so I'm talking with him about it, and he's like, and I asked him, well, could I possibly increase the blood thinners? No. Give them time give them time to work. Okay, not a problem. I figured it couldn't hurt to ask. Safer to ask than just to start increasing, because, well, that's something that's very dangerous to do. And also very stupid to do. So anyways, yada yada. And he's like, well, yeah, according to, it's looking like what you have is called antiphospholipid syndrome. It's like, oh, okay. Sounds vaguely familiar. I may have heard of it at some point in the past. But what the heck could it be, right? So I go and I Googled it, of course. Sorry, there's an emergency alert. Apparently kidnapping or whatever. So I go and I Googled it, and antiphospholipid syndrome, or APS, is an immune system disorder characterized by abnormal blood clots, pregnancy complications, and the presence of specific autoantibodies. So basically, some of the symptoms is the blood clots in my lungs. And there's also chronic headaches, low blood platelet counts. Those are the symptoms that I have. So apparently, the autoimmune, causes and risk factors. Autoimmune response: the body mistakenly makes antibodies that target blood proteins attached to fats, making blood sticky and prone to clotting. Triggers can occur on its own or alongside other autoimmune diseases like systemic lupus erythematosus. And yesterday I went and got blood work done to look for the lupus thingy. Risk amplifiers: pregnancy, smoking, long periods of immobility, surgery, or use of birth control pills. Let's see here. Diagnosis and treatment. Testing: blood tests checking for persistent antiphospholipid antibodies confirmed 12 weeks apart, paired with history of clots or pregnancy loss. Management: long-term blood thinning medications to prevent dangerous new clots. That's it. So, yeah, that's where I'm at. Okay. Now for the biggie. 310. All my 310s. So I'm still waiting. So I have to see this oncologist, because he's the one that will confirm whether if I have this the APS, antiphospholipid syndrome, the APS. Yeah. So, and I know the wait list for new patients for specialists is long, because my daughter, she was referred to a gynecologist for her PCOS, and I went and I asked them about an appointment, and they're like, well, it's because she's a new patient. He's never seen her before. There's a 1-year wait list. But she did recently get in to see him, and he confirmed that yes, that is what she has. Yeah, so that's where my daughter and I are in life right now. I've been focusing a lot on my cross-stitching project of the zombie kitten that she drew. Now I know there is at least one of my previous videos I did share a picture of it. And I know some of you are curious to see what it looks like. But I think what I'm going to do is I'll just, every so often, I'll show you the progress on it. I've been pretty much working on the background, because it's a lot of background. It's a big picture. It's a very, very big picture. I'm just gonna excuse me, I'm just gonna cover these with those. There. Yeah, so I will share the progress of the zombie kitten, but I'm actually I'm gonna set it aside for a while, because my dad showed me a picture of a sign that he was wanting to get for his girlfriend, get made, and I'm like, ooh, hey, I could do that as a cross stitch. And he's like, really? And I'm like, well, yeah, all I need is the picture. So he sent me the picture, and I'm like, yeah, I'll get started on it while you guys are away in August. And don't tell her, because it's going to be a surprise Christmas present for her. He's like, okay, awesome. I won't tell her. So, yeah, I'm excited to get started on that. I don't know exactly when they're leaving. But they're going to a city called Lloydminster. I believe it's in Alberta. Could be in Saskatchewan. I can't remember. It might be the city that's like half of the city is in Alberta and the other half is in Saskatchewan. Because I know that's the city. Because my aunt, my dad's older sister, her and her husband, they had a farm. Well, she's passed away now, but he's still around. So I'm pretty sure he still has the farm. Before she passed away, they were looking at selling the farm and moving into the city. But she used to work at the hospital in the Alberta side of the city. And they lived just outside of the city on the Saskatchewan side. Yeah. But yeah, so my dad and his girlfriend are going out there. They're going to be gone for a week. And to go to a wedding. My aunt, yeah, my cousin, my aunt that used to live out there, her youngest daughter is getting married. Yeah. So yeah, so they're going to that for that, and so my daughter and I are gonna go and stay at their place while they are gone to keep an eye on to take care of the yard and the dog. Yeah. Yeah, and I had coffee with my dad a few days ago, and he's like, yeah, I was talking with her with his girlfriend, and because she had they went and they got a new car, well, new-ish car, and she was gonna they were talking about selling her car, and then they were talking about it was gonna, and I'm like, well, I would love to buy the car. I would love to buy the car because it's a great car, and I need something that's better and more reliable. And they're like, and then they're like, she had talked to a mechanic, and he's like, well, it's gonna cost this much, and this, and yada yada yada, and so they come to me and they're like, no, it'll cost too much for the repairs, so we're just gonna part it out, and but because of the age and whatnot, and well, she finally decided. She actually Googled one of the repairs that she had been quoted like $2,000, and then she was told they'd have to take the whole dashboard apart and whatnot, and she Googled it, and it's like, oh no, apparently it's like 2 screws, one part of the dashboard, like where the center of the dashboard where the stereo is, and controls and whatnot. It's just pop that off, and it's like right there. So she's like, she changed her mind. She's like, yeah, you can buy the car. So it's like, okay. So my mechanic is going to be coming out to their place on Wednesday, and he's going to look the car over and see what all is wrong with it and what needs to be done, and he's going to let them know, and he's going to let me know, and then my boyfriend and my boyfriend's going to take me out there, and get the car transferred into my name and get plates put on it and get it insured and all that stuff, and then either I'll bring it back, either I'll be driving it back here, or I'll be parking it at the shop at my mechanic's place until he's able to get it all fixed up. Yeah. Well, actually, no. If it has to go to the shop, go to his shop to get worked on, then I'll just drive myself out there and do the paperwork and get the insurance on it, and then just drive it over. Like then it can go over to his shop, and then I'll just come back. But if it's stuff that I can get done later, then my boyfriend can take me down there. So anyways, I'm getting sidetracked. This is a lot. So I've got one empty row right here. So I'm actually going to move this row over. But should I keep it this way? It never stays the way it's originally set up, right? Right. And so I think what I'll do is I'll put it in order, in numerical order, to a point. Because see, here's 1, 2, 3, 4. So I'm just gonna do it this way, because thought I saw a drill. Keep finding drills. So anyways, so 1, 2, 3, 4, 5, 6, 7, 7. Okay, come on. 7, 7. 8, 9, 9, 10, 11, 12. 12, 12, 12, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 30, 31, 31, 32, 33, 34, 35, 36, 37, 38, 39, and 40. So let's move these over so they're all together. There. And then we put these in here. There we go. Look at all the colors. That's a lot of colors. It's going to be lots of fun to do. Especially all the black. That's a lot of black. Alrighty then. So now that I'm all done that, I'm going to put this in here as well. But I did actually cut out the name and put it on here too, right here. Yeah. So I'll set this aside for another when I am able to get to it. Yay! There we go. Okay, now let's see what's up next. All right, so that is all done. Where am I in my story as to what's going on? I think I'm up to date. I am eating better. I'm sleeping better. The weather here has been affecting my sleep. It's been when it's been like really, really cloudy from the fires, I was sleeping a lot. As soon as the weather cleared up, the last few nights, I've slept quite well, actually. Falling asleep around the time that my boyfriend goes to work, waking up not long after he gets off work, or the other day I was actually up before he got off work. Yeah, so things are working out. It's getting better. I have lost a little bit of weight and looking forward to getting back to my channel and my videos. And all right, so I've run out of things to say. So on that note, I'll see you in the next one. Bye.